My passion right now in Washington is getting a bill passed that reforms our mental health system to get more services to people in need. But I want to make sure that what I'm doing is anchored here in Connecticut.
Senator Chris Murphy met with mental health professionals, providers, and advocacy groups to discuss mental health reform Wednesday afternoon at Norwalk Hospital.
You have to take whatever bill you do and sit a CFO down with the people and say, how are people going to get this money to do what we want them to do in the first place? First of all, what do we want them to do? And then make sure that the financial people are involved and make sure that people get the money to be able to do that.
Wednesday's roundtable was part of a series of meetings the senator has organized to discuss what the federal government should do to support individuals who face mental health challenges.
I have a very hard time finding a psychiatrist in private practice that will take any insurance, or a therapist in private practice that will take any insurance.
The message was pretty consistent. There just isn't enough resources out there for people with mental illness, especially serious mental illness, and discrimination is real. Insurance companies are discriminating against people with mental illness. They'll provide you care for heart disease or diabetes, but they won't provide you what a physician is recommending you get for a mental illness. That's got to change.
Among those in attendance were representatives from the Human Services Council, the Norwalk Community Health Center, and Norwalk Hospital.
One of the big focuses of our bill that we're going to introduce, a bipartisan bill, is going to be bringing together the physical health care side and the behavioral health care side. So you can see a primary care physician. If you get diagnosed with early stage depression, you can go next door to the office right next to him to see a psychiatrist or psychologist. That doesn't exist in most places today.
I'd like you to keep in mind when you're making decisions for me that I'm a human being, and every patient is a human being.
Reporting in Norwalk, I'm Quadruba Coffey for It's Relevant News.